very bad tinnitus.
Yeah, I can see your cranial bones are a little bit collapsed.
Rhinitis, so like year-round sinusitis.
Toxicity might make you more vulnerable. And then we have the symphysis pubis. Show me your tongue. It means the blood's not really moving and the chi's not moving. It tells me if your system down here is working well. And hold up again. Up, up, up. So, do you feel the difference?
Wow.
Huge difference. Or it could be a symphysis pubis thing. So you just touch that and we retest and you hold. Okay.
Wow.
By using leverage principles, I can just rebalance everything, all the ligaments in your pelvis. But as soon as I get near to your liver, mobilize and move each vertebra. If I'd have come directly to your neck, then it might have been much more difficult to get inside. Up, up, up. Okay. So I can't move it. So that says your symphysis pubis is now in the right place. So, and relax, yeah.
Hi guys, Victoria and John here, and John's just about to give me a core therapy. So John, there's a couple of things that I'd love you to work on with me. I haven't had a core treatment for over a year.
Okay. We're all the same. Yeah.
I wish I...
Yeah.
There's no one near me.
Yeah.
There's
people near me, and I'll get 10 minutes once a year or something. I'll say, can you just do this?
But I know I'm greatly in need, so
Yeah.
you'll probably have a whole shopping list of stuff you'll find.
Okay.
I get very bad tinnitus.
Yeah.
And
Both ears?
In the centre.
In the centre, yeah.
Yeah. So I've had it for over 30 years, so most of my life. And it doesn't bother me.
Can I say, as soon as I look at you, I can see your cranial bones are a little bit collapsed and a little bit off-centre. Right. So immediately there's something there that's not right. Okay.
Just let you have a look at me.
It's this shape that doesn't suit you. I know that sounds a bit weird.
It doesn't look straight.
Doesn't look right on you.
Okay.
Yeah.
Yeah, okay. I've got so many questions in my head, but I need to stay focused.
Yeah.
I have rhinitis, so like year-round sinusitis, maybe through dairy products, maybe through dust or pet fur.
Or your cranial bones.
Or my cranial bones, okay, all the same thing then.
I can see it.
Okay, so I've had that for many, many, many years. And I've tried all sorts of things, but obviously not the cranial bones. And what else? Last week, I had a stomach bug.
Okay.
And I think I'm still trying to get rid of it.
Okay.
I'm much, much, much better, but I was deeply fatigued and stomach pains here at the stomach organ, and not good.
Okay.
Yeah. But much better now. So there's 3 things for you to think about. Okay.
So we have these 5 fundamental physical imbalances in the body. So we have sphenoid, which will affect lots of things. Yeah. Neurologically, especially lower back pain. I know you didn't mention lower back pain, but we have C1, C2. Yeah. So the sphenoid, we connect to the heart. Right. Yeah. So I'm not expecting much of that because your heart and spirit feels good.
Thank you.
Yeah. So number 2 on the list is C1, C2 that's connected to the kidney system.
Yeah.
So I'm suspicious of that because I'm always suspicious of it. We all have C1, C2 issues.
Yes.
But I'm suspicious because I have a feeling that that's not right and it's leading to some of your symptoms.
Okay.
Yeah. So the next one on the list is a sacroiliac strain in your pelvis. So your pelvis will not be aligned.
Yeah.
And that alignment will have an effect on your detoxification.
Yeah.
So a bit like a car, you've got an engine going on in there. Yeah, you're burning stuff to be you and what you're thinking and what you're doing. And if you can't get the exhaust out of the car, they will back up and cause a lot of problems, which could be digestive wise.
Yeah.
That toxicity might make you more vulnerable. So it slows your recovery down and makes you more vulnerable to getting something. And then we have the symphysis pubis, which I'll test first.
Yeah.
Because that supports the whole digestive tract.
Yeah.
And it generally gives you your upness.
Yeah. Okay.
And then the last one's the ileocecal valve.
Yeah.
So I'm just gonna screen those, because if you have one or all of those imbalanced, you're going to be vulnerable to thousands of different symptoms that aren't really relevant, because they're only there because you have those imbalances. So keep it simple and direct, and if we deal with the underlying things, what's on top, all of you, what you're feeling,
we'll all sort out.
Goes. So you lay on your back then.
Thank you.
Okay. Comfy?
Yeah.
Just show me your tongue. Okay. So it's a bit dry and it's a bit purpley grey. So it means the blood's not really moving and the chi's not moving. So could be that you didn't have core therapy for a year or longer. So let's get a feel for everything. Hold that up for me. Brilliant. So that's nice and strong. Yeah. So I'll do a little test here. It doesn't prove anything at the moment, but it tells me if your system down here is working well. And hold up again. Up, up, up. So do you feel the difference?
Wow.
Huge difference.
Yeah.
Your nervous system has just gone, I don't like this. Put me back. So it's saying, put me back as quickly as possible. So we go to that muscle again, hold up. And you see it's really strong.
Yeah.
So as soon as we change something, I'm looking for change, and that says something's wrong here. Yeah. So other side, hold up. Perfect. Bend that one. And we just say the same thing. Okay, hold up. No. So stay there. Because I've got a weak muscle, I can now ask your body, where's it coming from? What is this weakness?
Yeah.
So it could be a knee thing, it could be a hip thing, it could be a pelvis thing, it could be a spine thing, because it's all rotated. Or it could be a symphysis pubis thing. So you just touch that and we retest and you hold. Okay.
Wow.
So your symphysis pubis is slipping.
Yeah.
And that slippage works on your line here, so your digestive system especially, but also your back. So your back's vulnerable while you have, when you don't have a good symphysis pubis. Okay, so that's the foundation of your body. Your pelvis is the foundation. Everything you do comes from your pelvis. So your pelvis is supporting all of these muscles and all of these muscles and all of them muscles and all of them muscles. So any imbalance and misalignment then feeds into other things in your body. Okay. So let's have a look at your sacroiliacs. Hold them two up. Up, 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 up. Good. That says I'm fine. And hold up, please. Up, up, up. It's strong, but did you notice the difference?
Recruiting, aren't I?
Totally. So your body rolled on that one. So now I'm going to ask a question. What that tells me is there's a problem in this right sacroiliac, but I need to know, is there something going on in your head that's causing that? So we do exactly the same test again. All you do is put your finger on the roof of your mouth. That's it. And we say, are you okay? Hold. What do you think?
SBS.
It's a huge difference, and all you did was touch that. So if you've got a problem in there, then that means I have a problem with my palatines, the roof of my mouth,
Yeah.
the vomer that goes down between my nose, potentially the ethmoid, and potentially the sinuses, and potentially the frontal bone. So all of that front area that I noticed before, just one touch says, oh, I'm not happy. And when you touch something that your body's not happy with, we get a neurologic reaction that gives us the information. So just pinch your top of your nose and hold up, please. Up, up, up. It's not great.
No.
And touch the forehead and hold up. Perfect. So that says I'm good. But inside here, so behind your nose and your cheekbones and in there, it's not happy. And it's affecting your sacroiliac, which is what most people in the world suffer with.
Yeah.
Okay? Because then that could lead to hip issues, knee issues, ankle issues. Because the sacroiliacs support your pelvis and hold everything together. So who you are when you stand up in the morning is often sacroiliac, kidney orientated. Here I am, I'm ready to go. Or you stand up and go, oh, I'm a bit tired, or I feel old. That's what people would say. I'm just feeling old.
Yeah.
Right. So let's ask a bit more about your pelvis. Hold them two together. Hold, hold, hold. Perfect. And then I'm challenging the ligaments and hold. Okay. And hold. So, you feel it? And now I'm challenging other ligaments, other movements. Hold. Perfect. And hold. Not perfect. I don't need to pull hard. You can feel it go.
Yeah.
So there's instability on the right side. Yeah. And that just can affect so many different things. So we've got a problem going on inside the head. We've got instability in the pelvis. So you said about your sinuses, and then you said about your digestion. So let's just have a look. You can relax. You can relax. Just put your hand there. Hold that up, please. Perfect. And just go down a bit and hold it up. Not perfect. You feel the difference. That's just 2 inches. So as soon as you touch something your body's not happy with, you get a neurologic reaction, and it says something's not quite right there. Right? I'm going to try and use a bit of intuition here. And just push on your spine. You got any pain in there?
No.
Okay. Just put your hand back where it was.
There?
And hold up again. Okay. Different?
Yeah.
So, this tummy imbalance
Yeah.
is coming from the curvature in your spine.
Yeah.
So now we have to, the psoas muscles create the curvature.
Okay.
So let's go and ask them a question. Hold that up, please. Up, up, up. And it says no.
No.
You feel it?
Yeah.
Yeah? And hold that up. Up, 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 up. No. You're really trying hard.
really
You're trying, you were using your chest, your lungs, your jaw. Okay. So if you have bilateral psoas, it means C1, C2 is blocked. So press where I'm pressing. And then we go and ask, is this the right place? Hold up. And it says,
Wow.
it's really dynamic.
Wow.
So if you keep your finger there for 3 days, those muscles will go strong and you'll be happy.
Easy.
Yeah.
Okay.
So, no, I now know where I need to go. Just lift your head up a little and down, please. So just having a little look around here. So it's quite deep. Can you feel it deep inside there?
Yeah, it's not too bad considering it's your
hands. There's a little bit there. You
okay.
feel that?
Oh.
Yeah. So all I'm doing is
That
just
was
a little press, and your body's gone, oh, I hate it.
Yeah.
Where there's a blockage, where it's stuck, it'll be inflamed all the way around there. So as soon as we touch it, and the reason I've touched it is so that your brain can do something about it.
Yeah.
And if I don't touch it, you won't really know it's there. Because you know it's there, but you need or let's say your subconscious needs reminding it's there. So when we go and feel it, it goes, oh, what's that? Now it becomes a conscious. So both subconscious and conscious can go and do something about it.
Right.
Okay.
Okay.
So let's do a little treatment. Turn over, please. So I'm going to repattern your pelvis, put it back into its balanced position, and then at the end we'll retest it to see if it's balanced. Okay? Hopefully the camera doesn't pick up your holy socks. So this is real, isn't it now? This is so real because you forgot to put good socks on.
I had no idea there was holes in my socks.
It's only an inch big. So I'm off camera at the moment. Oh no, the side one. So I'm just looking for any blockage in the foot. And around spleen 4, there's a bit of a blockage in there. But what I'm really concerned about is that pelvis. So by using leverage principles, I can just rebalance everything, all the ligaments in your pelvis. Any pains?
No.
Good. And then what happens is your feet position was straight, and now we've got this nice curved, relaxed posture.
I can feel it, lovely.
So again, around spleen 4, kidney 2 area. So that's quite strong in terms of reproductive stuff. There's a bit of a blockage, you feel it?
Yeah.
So it's the same on both feet. So a little movement, rebalancing, repositioning, repatterning. So we don't need to use anything strong to crack you back into place. We just need to use very light fascial stretches and mobilization. Okay. So now both feet are nicely flopped and curved. And I'm going to use some qigong energy work just to harmonize the sacrum. So the sacrum floats around in tissue and fluid, and it needs to be centered. So often it becomes uncentered, and then we get changes like scoliosis would be an example of a misaligned sacrum. So the way we do this is a little bit like imagining you're on an airbed in the sea. So you're laying on an airbed, you're in the sea, and all of the dynamic movements that come through the water. So the current of the sea, you know, the pushing and rolling of the sea, it has so many different directions that it flows and pushes. You know, if a whale swam past a week earlier, that would create a new movement in the water. How far does that travel when it's in the sea? Does it travel 20 meters, or does it travel 200 kilometers or something? You know, so you've got all of these different things moving water, and stuff tends to vibrate through water at a much further distance, a bit like sound. So I'm floating on your sacrum now, and your sacrum and all the movements, the internal body fluid movements that are happening are effectively talking to me under my hand, and I'm just going with it. So my energy is allowing it to reposition itself, because it knows what its position should be. Yeah. Did you feel anything there?
Amazing.
So now we're just looking at the movement in your spine. So this is not bad. It's tight, but not bad. But as soon as I get near to your liver, I've started to hit. Can you feel the difference? Yeah. So I've started to hit, let's call it high tension. So that bone there is not rolling. So to release the spine well, we need to get your pelvis rocking and rolling, yeah? And if it's rocking and rolling, we can do a good job on your spine, because it means it's moving up and down the body. And then the muscles either side, you feel how tight that is? That means that your glutamus maximus have not been working so well, which means C1, C2 is blocked. And as soon as I touch there, you can feel that. That's really out of position. So the big work has to be done on your neck. And some work here just to free off the spine. Both shoulders are very, very clear. Considering you've got a tight spine, your shoulders are floating very nicely.
I do a lot of yoga, so some of my body's okay.
Just that would be my concern, just this centre point on your spine.
Okay.
It's really quite unhappy. It's moving more than it was, but... Okay, turn over, please. When I'm doing this, it's not really for your shoulder. I'm actually feeling the vertebra in your neck, especially the opposite side to where I'm working. So as everything's interconnected, when I pull on this, I can get a feeling for what's moving and what's not moving, what's working and what's not working. So I can actually mobilize and move each vertebra individually. So I'm closing my eyes to get a better view of what's going on inside, if that makes some sense.
Fascinating.
So this is a little energy and fascial type of release. And this side's much different from the other side. So I'm going through to the right hand side of your neck, right at the top of the back, and it really doesn't want me to do it. So it's quite angry. Not angry, that's the wrong word. It's quite stuck. So the vibration of something that's stuck can give you the feeling of anger. It's like, and as I draw it away from your body, your whole head kind of comes to me instead of it should be your chin. So your head should roll when I do that if we've got true movement in those vertebrae. So again, it's your body's constantly drawing me to where the problem is. So just lift your head up for a sec. Okay, let's get rid of that. And drop down, good. So let's have a look again. So already it's much easier than the first time I touched you. I touched it when we were doing the muscle tests and I came up here.
Yeah.
So the surrounding tissue around the problem has relaxed because I've released off pressure in your pelvis and your spine. So it's already released. So it means when I go into your neck now and I want to get the vertebra in the right position, everything around it's already softened. If I'd have come directly to your neck, then it might have been much more difficult to get inside because you've got layers of tension protecting a very old injury. So when I'm here and I'm pressing on this might sound a little weird, but it feels like you were 7 years old when you first injured your neck.
Okay.
Do you have any memory of that time of your life? Were you a bit crazy? Falling off your bike or something?
I can't remember anything from 7.
That's okay.
I mean, I don't know if seatbelts were in cars when I was 7, but I know my mum had an accident in the snow.
Yeah.
And I was little.
I'm not so sure we were wearing seatbelts, especially not in the back. Because when I learned to drive, it was kind of like they started talking about or insisting on seatbelts. There was lots of adverts, wasn't there? Clunk, click and all that
That's
sort of
it.
stuff.
Yeah.
So that was when they started trying to educate the public before they brought a law in about it. You feel that down there?
Yeah.
Yeah, so that's
It doesn't
T1.
hurt.
No?
It just feels absolutely stuck.
Yeah. And that's
I don't know why that doesn't hurt.
twisted out to the right. So if I touch it on the left side, you'll find that there's no bone there.
No, it's absent.
Tough. The tissue is tough around it, but
Yeah.
this side is a little more, I'm going to say angry again. So that right shoulder is shortened.
Okay.
It's been pulled towards your neck. So that would be typical for someone with a frozen shoulder on the right side. They would have a blockage on the right side, C1, C2, and they would have T1, C7 blockage, and all the muscles will be short, and then they try and move their shoulder and they say, I can't move it. And it's like, yeah, because it's not a shoulder problem. The shoulder is at the end of the movement. You know, the mechanics that allow the shoulder to move, that's where the problem often is. And because that doesn't get fixed by the orthopedic doctors, then typically you're going to have an operation, and 2 years later it'll be in your left shoulder. It'll just swing across to the other side because the origin is still at fault. It's not moving. So that is a little strong there. Okay, Just trying to remind your body where your shoulders should be. Yeah, so your gallbladder. So there's a bit too much overthinking going on here. So this is gallbladder 21 acupuncture point.
Yeah, that is so.
Yeah, and it's here. And that means the energy has been cycling between your shoulder and the gallbladder comes all the way down here through your sacroiliac ligament, off your hip, all the way down here. So there's a meridian called the girdle meridian, or the belt meridian that goes around. It's the only one that goes around the body. And its points to activate it are gallbladder 41 and Sanjiao 5. And what they do is they connect everything together. So people that have a lot of mid-weight in the centre here, a lot of pressure on the back, typically these two acupressure points have become disengaged. So the belt that holds you together opens and you become very weak around that area. That can affect our sleep. It can affect our, I'm going to call it phlegm. So phlegm in the body, phlegm becomes fat eventually. So we start putting on weight because this isn't controlled and pumped through the body. So your gallbladder problem is there's a bit too much overthinking going on.
Okay.
So I would stimulate points down here to help draw it down. And then you'll get a really good sleep. Because your body will just go, poof, and then it'll be time to wake up and you'll go, what happened? And it'll feel like 3 seconds. You'll go, how can that be 8 hours? That can't be 8 hours because I just fell asleep.
Amazing.
Yeah. So it means that you go really deeply and then you come out. So then we go back to asking the same questions. Yeah. So this was the first one. And you're going to hold up, please. Up, up, up. Okay. So I can't move it. So that says your symphysis pubis is now in the right place. Hold up. Just great. And then we had your kidney system, didn't we? So this one needs to go up, please. Yeah. You're engaging other muscles.
Yeah.
But it doesn't matter. That's just history because you've had to do that for years. Yeah. So hold this one up, please. As long as we get that feeling of tension. So when you stand up, you should stand more like this. Here I am. And less like there I was kind of thing.
Right.
Yeah. I think that was about it, was it? Oh, Ipsy. Hold up, please. All right. So what I want to do now is put a glove on and I'm going to go just
Yeah, I was wondering about that, yeah.
And then I'm going to open all of this up. I just felt like I needed to release your neck to allow this to open.
Okay.
So sometimes I'll start there.
Yeah.
And sometimes I'll just wait until the end and so you can just go. Yeah.
Okay.
So this is no pressure at all. It's the lightest touch. And the bones will just do what we want them to do. Okay. So, and relax, yeah. So initially I don't really feel much. There's no big movements going on, it just feels a bit closed. So there's a little bit of rocking motion, that's all. Okay. Done. You look 10 years younger.
Wonderful. Worth every penny.
Okay.
So you don't need to retest anything?
Well, I retested those big things and I'm happy. Yeah.
No, doesn't need it.
No.
Cool.
No. You need more of that because
Yeah.
I can still feel the roof of your mouth is just slightly misaligned, and that needs to drop back into its natural position. So it's slightly misaligned, but it can copy the pelvis.
Right.
So now the pelvis is back in order. That I would hope will just drop out.
Okay.
Yeah.
And we're on the core therapy conference tomorrow, so I might get a little bit of treatment.
You might get a little bit of treatment there. You never know.
Nice.
All right.
Okay. Thank you, John.
Okay, my pleasure.
Oh, I feel great.
Good.